Hi, I'm Dr. Lanny Brustein, Austin-based chiropractor. I'm with Keith, who has some jaw pain. Keith, tell me, why were you sent to my office?
I was referred to by my dentist.
Okay.
She referred you because I was having jaw pain and some TMJ, and you're the expert.
Well, please tell the audience, what is it you feel on a daily basis as far as discomfort on the jaw and TMJ?
When I chew a lot, my jaw starts hurting, and it sort of knocks it out, knocks out of alignment. So I need to get aligned regularly.
Keith's been in several times. We kind of developed our own little protocol. It's a little different than some others. So I'll be using manual adjustment by hand. I'll be setting the jaw. It'll look a little aggressive versus an activator. Ready for adjustment?
Russ, I'm ready.
Excellent. I'm going to give you a very quick anatomical perspective of the skull from the front and from the side. We're going to take the jaw off from the skull, and I'm going to explain to you how the TMJ dysfunction occurs. I'm also going to show you how I'm going to perform the adjustment on Keith today. Jaw and the TMJ joint should be moving very nice and smooth. I'm going to take the hinges off and show you the parts of the TMJ itself. So first, let's look at the jaw, the mandible. The only things you need to worry about right now is this top part, which is called the condyle. This part is called the ramus. And here's the body of the mandible. The jaw can, like I said before, jut forward, it can jut back, it can roll like an airplane wings, it can roll up to the right, up to the left, or actually going inferior and superior, or it can go three-dimensional. So pitch, roll, yaw. And if that's the case, you're starting from here or from here, and then you're going to talk, chew, bite, swallow, laugh, cough. So the jaw will hang to the skull basically by 8 muscles, and they have to move very smoothly. So there are 2 muscles on the outside, 2 on the inside, 2 on the inside, 2 on the outside. They're called masseter temporalis, internal, external pterygoids, and then masseter temporalis. They should be moving all 8 with nice symmetry. The jaw moves like a hinge. So if there's trigger points in the muscles, or if there's a problem due to trauma or the condyle or the disc in between the condyle, where you get the click in the jaw, it'll deviate and it'll ratchet and ratchet back. So you can see where people's teeth are not lined up in front. You'll see when they go to talk where the jaw comes like this, and it kind of horseshoes a little bit and deviates. So that's called ratcheting. First, I'm going to do a little stretch for you. Breathe in, breathe out. Breathe in. Breathe in. Out. Breathe. Good. I'll flip you over. But first I'm going to start with doing some massage, some very light massage on the temporalis and masseter muscles. I'm going to come up to the temporosphenoidal line, where origin to insertion of the muscles. Then I'm going to do an old osteopathic technique, which is part of the Cranio-Sacral technique, and I'll only do part of the cranials on the exterior part of the skull. So an important part of treating is you just don't have people walk in the door and just lay down cold and whack and crack. That is not how you adjust properly. You prepare the tissues, you prepare the person. That way the adjustment is much more relaxing and the adjustment holds for a lot longer. Take a deep breath in, breathe out, breathe in, breathe out. Breathe in, out, in, out. Breathe. Breathe out, in, out. Out, in, out. Breathe in, out. Right here is where that condyle goes into. That hole right behind it is where your ears are and your eardrum. That's the external auditory meatus. And so that's where your ears and your hearing is going to be. So in the clicking, you'll hear the vibration. Sound actually travels better through bone than it does through air. So you hear it right there every time the person opens and closes their jaw. On the edge, this is the mandibular fossa. And you'll see it on both sides. Is right here and right here. Where my fingers is that deep is where the condyles will sit, and the disc can pop and make the noises right into your ear. So let's put him back together. And from the bottom perspective, you can now see where the hinge joint will occur or if there's deviation. You can deviate here, you can deviate on that side, you can slide to the side, and so every time you're opening it, click, click, click. So also let me show you how I'm going to adjust Keith. So I'm going to cradle the skull, and when I set up, I will feel where that joint is, right there in the TMJ, right in front of the ear. And I'm going to slide down the ramus, and I'm going to take pisiform and hypothenar contact of my hand on the side. You can get that? And I'm going to push 45 degrees in that plane of motion. So he's cradled, the jaw would be open, and when it's hanging, that's when you let him breathe out and you take the adjustment. All right, so we're going to adjust Keith's jaw, and I'm going to do it by hand, martial arts style, Shuto hand. So he's going to turn his head to the left. I'm going to cradle the skull, and I'm going to use the inner part of my forearm and cradle the skull while I'm resting on my thigh. So his head and neck are very braced. He's really good about relaxing, so I'm gonna find where the joint is, open, and close. There's the condyle. Open. You can hear the click already. Take a deep breath. I'm gonna turn the other way. Same thing, cradle the skull, protect the face and forearm, using my thigh, open. Take a deep breath. Good. So most of the time you would do the jaw and then the neck after. With him, his neck moves at the same time. So if any other chiropractor who hears this, don't adjust the neck first, because if you do it, you're going to lose a lot of tension. Do the TMJ first, neck will release, get the rest of it, or leave it as is. Okay. Get you to lean on your side, facing me. Bottom leg is straight, top one is bent. Locked. Take a deep breath. Out again, and roll over. Take a breath. Sit out. These are called an Anteriority Board. To do an anterior posterior adjustment, I use what's called an Ape Hand. Get the spinous processes right in between the middle of my hand. Curl down, breathe out. We just finished Keith's adjustment from jaw to lower back. How do you feel right now?
Sore.
Sore. And the jaw, I feel the neck that's sore.
Jaw.
On the jaw, okay.
Regular adjustments to keep it straight, keep it aligned.
Okay, so the jaw is moving tens of thousands of times per day between laughing and swallowing and chewing and coughing, sneezing, brushing teeth. So if the jaw is deviated and we set it and he goes back to do 20, 30,000 motions a day within 2 or 3 days, the soreness will relax, but then the problem can also come back. So that's why we have to kind of realign it. We work with the dentists, oral surgeons to kind of keep it in place and correct. I want to thank Keith very much for coming in today and allowing to be filmed. He's a great sport and thank you. So thank you very, very much.
See you next time.
I will see you next time. I'm Dr. Lanny Brustein, Austin-based chiropractor. Look forward to making more videos for you guys. Hope that was helpful. If you like, please hit the like, the share, and subscribe. See you next time. This video is instructional and educational. Do not try this at home. Kids, adults, drunk party animals, do not try this on another human being, okay? I was taught TMJ by my father, who was a practicing dentist for 58 years. My older brother, chiropractor, he taught me how to respect and adjust this as well. I was trained in school, and I have 30 years of clinical experience to do this. Majority of chiropractors don't do it themselves. Dentists certainly never learned it, and all surgeons, they don't know how to do it either. So if you have a TMJ problem, please bring it to me. If not, find yourself a local chiropractor who knows what they're doing, either by hand, or we can also use an activator, that one as well. But please, 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 do not ever try this on anyone else. Go to a trained professional.